most prestigious and the most well-known facial treatment in Hollywood. Hooray! Yes, I'm so excited. Nowadays, people are very skeptical in facial treatment. Why? Because they are promising the sun and the moon. However, is clinical fire and ice facial treatment comes with a high-profile business to back its claim. Let's try it.
This Clinical is a company from USA, California that stands for Innovative Skincare. And Fire and Ice is one of the widely endorsed and accepted by Hollywood celebrities. So just to give you a little background, before Oscars all the Hollywood celebrities go and get this facial done to get that immediate glow, immediate gratification with no downtime. So the thing is that we are going to do two different masks. One is an intensive resurfacing mask, which is a fire mask, and the other one is a rejuvenating mask, which is the ice mask, which is the cooling mask. The beauty is that we do 18% glycolic in the fire mask, but there is no post-procedure peeling effect. So that's something the catch. So once you do the peeling, whatever happens on the skin while you apply the mask, but there is no post-procedure peeling, which means there is no downtime. Okay. So the first step is that we do the cleansing with cleansing complex. This has got half a percent close to glycolic, half a percent salicylic, chamomile extract, mushroom extract. Now, this is just the chemical composition or the ingredients of the product, but the pH of this particular cleanser is 5.6, very similar to the pH of your skin or anyone's skin, which is 5.5. So this cleans well because it has got salicylic. It also loosens up dead cells because of glycolic. But the most important thing is that it does not make you feel dry. So if in case somebody has distressed skin, compromised skin, they won't feel any kind of dryness or stretchy feel after the cleanser. That's why it's one of the very different ones. This is a universal cleanser. It can be used for all skin type, all ages, any skin condition. The good thing is that even somebody got makeup, you can remove the makeup with this one. The only thing it cannot do is the waterproof makeup. So we have a separate product for waterproof, but it's a universal product in that case. It has got a built-in toner as well, so there's only one product which does a bit of both the things. Okay. Now, as you have cleaned your face, so I'm not repeating that step. You have tried it, right? So we are going to start with the second step, that is the intensive resurfacing mask. This is the fire mask basically. Okay. So intensive resurfacing mask has got 18% glycolic, niacinamide, and cinnamon spice. The thing is that this glycolic is, as we mentioned, our products. All of these products are botanically derived, but are pharmaceutical grade. There's nothing which is chemically synthesized in the labs or artificial products. So for example, here the source of glycolic is from sugarcane extract, which is a natural source for glycolic. But as I mentioned before, that we use the products which are pharmaceutical grade. The potency is very high when we use any product from the plants. So though these products are natural, but they are not at all compromised in terms of efficacy. Important question before starting the facial, we need to know the history of the case. Okay, if she has got done any recent procedure done, which means fractional laser, any kind of invasive procedure, fillers, whatever it is, right? Because this peel is going to obviously exfoliate the skin. That's the prime indication, right? But if in case you have recently got done any kind of derm up and people just get it done like 3-4 days back and they find their skin is okay, it's fine to do, but I would advise that take a 2 to 3 weeks break at least before proceeding with fire, and just to be on the safer side for the first time, right? Now she has undergone a fractional laser a month back, and after that she only peeled off for like 3-4 days after that, not long as is what she has told me. So I see we can start with fire and ice, but I might not go for the entire duration for the fire mask to be administered on the face. I might withdraw it after 1.5 minutes if in case she feels too much burning. Just to make sure, because her skin is clean at the moment. She might not have that much stratum corneum to be removed, right? And we might end up, hampering the clean skin. So it's advisable. 28 days is fine for dead cells because the cell cycle has the self-renewal 28 day cycle, so it's fine. Okay, this mask will help you do 35 cases. Okay, and you just need 3 grams per patient. Now what I do normally is I take as little as I can because I can always take more, but there's no point taking too much because you don't require that much as such. So this much is good enough to start with. Now this mask has to be applied thick enough to cover the skin and thin enough for the skin to be visible beneath. Okay, so we will not apply too much, we just apply moderate quantity just to cover the face, thick enough to cover the entire face, thin enough for the skin to be visible. Okay, when I start applying, you can apply by gloves, but with a brush, but I would prefer fingers because this is faster to apply. We start with the less sensitive area, then we go to the cheeks and the forehead. Just keep your eyes closed because I'm applying this. Can you just time it after this is done? Okay. And this mask should be applied quickly. You should be as quick as possible.
Smells good.
Yeah, it smells like food, right?
Cinnamon.
Yeah. We will not go close to the eye area. You need the periorbital bone. You will be just below the periorbital.
And as we mentioned, it's not only glycolic acid, it's glycolic acid 18%, retinol 5%, and antioxidant, anti-inflammatory, plus vitamin B3, which is nicotinamide and niacinamide, which stimulate the cerumites.
Okay.
So, again, you might be feeling a little of a tingling sensation. Is it?
How do you feel?
Not yet. Put some contour.
Is it only on the face? Can be covered up
Yeah,
to
you
this
can go
area?
to neck, you
Neck
can go to
area?
decolleté, is fine.
And actually it depends, like even the quantity and the duration. For example, the recommended duration for the first mask is 5 minutes. But it
You can
depends.
also put on neck.
Yeah, it depends
Yeah,
also about the tolerability of the skin. For example, if you're such a girl who's doing procedure every month, so that means like your skin is tolerable for this exfoliation and alpha-hydroxy acid. So you might not even feel the tingling on spot. Like for example, if you first time doing exfoliation or using the alpha-hydroxy acid, once you apply the mask, you will feel directly the tingling effect of the any alpha-hydroxy acid.
Mm-hmm.
So you can apply on the neck area, is fine. Can you just time it, please?
Now how are you from?
Can you feel any kind of burning sensation anywhere?
Tingling. Only on.
Perioral area?
Yeah, that's yeah,
And?
and a little bit on the forehead
Okay. Anything on the cheeks?
and a little on the upper lip.
Okay. On a scale of 1 to 10, what do you feel?
1.
1 really?
Or maybe 2.
Maybe
It's
also
getting-
because it has some pimples, so it will be also very
Which part?
effective.
Which part? Yes?
Yes, here. So even it's perfect for acne prone skin.
You want to try and have it at the back?
There's a
You are
little
trying it with what?
tingling sensation.
Is this how much?
No, no, it's fine. How many minutes you want to leave?
3 minutes.
3 or
3. This area, right?
in
So-
upper lip.
So
That's all.
is it increasing now?
Like 2 to 3 range only.
That's why I see the most common answer is basically about 4 when they rate it from 1 to 10. But in some cases, just keep a watch on that. 3 minutes I want to remove this. But some people might find it 6, 7 also. Depends on the pain threshold. Depends on what kind of how used to they are with the pain. Everyone has a different reaction to things. But 3, 4 is fine. For your skin, I cannot see any. See, the reason of applying the mask thick enough and thin enough to see the skin, right?
Yeah.
Just to make sure that you don't have any kind of activity on the face, on the both sides, right? What I saw is some kind of redness, blemish over here, a little erythema, so I just kind of neutralized from this area. I don't know, it's just a normal.
Normal reaction.
Yeah, because she's not feeling anything. So maybe maybe I'm just confusing with the lip line over here. Maybe, yeah. So that's why I just removed it on the precautionary side. We don't touch the eye area as such. We go. Now the interesting part is when you neutralize it, you have to neutralize it twice. First we neutralize with water, and then we neutralize with cleansing complex. The reason is, water basically just to clean the area, and at that time people would feel more burning because a basic and acid reaction, right?
Of course.
But the cleansing complex is important to neutralize to bring like the pH, because after you apply the mask and withdraw it, the pH is somewhere around 3.5, 3.5, which is very acidic, right? People feel too much burning and tingling sensation. When you apply the cleansing complex, because its pH is very stabilized, you would find the pH is coming back to normal. After that, it's good to apply. Otherwise, they might end up kind of getting erythema or something, just to make sure that you do twice again. It's good.
Yeah, it's good.
1 month.
And then you're telling when Maria's out that taking Roaccutane or any medication.
Yes, so if in case somebody is on Roaccutane, because this particular procedure is not for sensitive skin, so somebody is on Roaccutane, it's advisable not to do.
Not to do.
Because
When
their
they
skin
can do.
becomes very sensitive.
Yeah, when they can do.
See, it depends. It's your call. I would leave it on you. Ideally, many of the therapist physicians, they don't touch their skin for like months after the Roaccutane is even stopped, because it takes longer for the skin to heal back.
And even some other schools, like going more aggressively and even doing chemical peel during the work. It depends on the school of the doctor, and it depends on in your assessment. So you will find this school very cautious, and you will find the other one which is very aggressive doing chemical peel during the work time, because they need the exfoliation.
Yeah.
I'll be removing it now. Okay.
Okay.
I'll be starting with the more sensitive area first to apply, remove it from the cheeks. Okay. Where she was complaining more. Do you feel the sensation more now?
More, yeah.
Right. That's what happens.
When you apply the water.
Yes. I did not apply the water. I'm just neutralizing with water first.
Yeah, now it's like 5
Yes. So it normally
5 to
increases
6.
for everyone.
But tolerable.
Yeah, because you are a superwoman. You don't feel anything.
No, because my skin is tolerable.
Yeah, it's actually good. Your thin is actually, you were right, it's thick.
No,
Otherwise,
yeah.
you might have felt it more.
And even again, it's in your call. For example, when you're going to proceed with fire on ice with a tolerable skin, so you can leave the first mask, which is fire, up to 7 minutes. It's up to you. You know what I mean? So normally recommended time is 3 to 5 minutes, but it depends. For example, if
This
you
is
have
the neutralizer.
Yeah.
Thick skin,
Yes.
so you can leave it a little bit longer.
yes,
But if it's thin skin, 1 minute, 1.5 minutes, you can remove it. Or minimum is 3.
2 to 3.
2 to 3.
minimum. And it depends, if the pain threshold is becoming so high, so for example,
Terminate, yeah.
I cannot tolerate it anymore. I'm feeling so much much sensation, or maybe she didn't tell you that she had procedure last week or something. So no, directly neutralize it.
So now we'll clean the face again to bring back the pH. Okay. I hope you're feeling it now. All
Better.
okay, right? So that's about it. Okay, so when you do this particular procedure, see, it's not a standard protocol what I'm gonna do after this, which is the eye treatment, which is not a standard protocol, but I find it logical and useful, because when you do this facial, right, you are anyway going to clean the entire face. So why not clean the eyes as well and do the eye treatment along with it? It's not a much of a cost, but at least you do the complete coverage of the face.
It's true.
And at the same time, you're going to have the option even to do it in the package. Like for example, if you do this hydrofacial with fire on eyes, you can get the eye treatment for free. The eye treatment is just 2 creams. One cream and one serum. But it's really good for the eye. Like the first cream that you're going to apply, it's called Eye Complex. It has hyaluronic acid, so once you apply, plumping directly into the periorbital area. And at the same time, the CI serum, it's 7.5% vitamin C with hyaluronic acid.
The eye first for you, okay? Eye is simple. It's just a drop of this, okay? Mix with the Hydro Boost. This is the additional thing I'm doing right now. It's not a standard protocol. So you just mix with this, mix it around, okay? Just keep your eyes closed. You just touch the periorbital bone, okay?
Why you have done it with Hydro Boost? Because Hydro Boost having 25% hyaluronic acid. Plus the hyaluronic acid, the 5% it's already existing in CI serum, plus the vitamin C, plus the carbohydrate glycolic.
Okay? So, this is it. Top mark. After this, we are going to take the. Just don't open your eyes, please. So that
Don't open your eyes.
you'll get to see it later. This is a rejuvenating mask. Okay. Now this has got sodium hyaluronic acid, rosemary, peppermint, menthol, vitamin B5. So basically it's going to give that immediate plum on the face, hydrate it and cools it down. So you would require this much. If in case I would require, I'm going to take it later. Now this mask can be applied all over the face, including the eye area also. Okay, you can just start applying. You could feel a little of a cooling sensation. I'm applying something on your eye as well, so just don't open your eyes for like next 10 minutes, okay?
So this mask giving you hydration because of the hyaluronic acid, plus antioxidant, anti-inflammatory effect, plus stimulating collagen, and at the same time counteracting like any kind of redness or like counteracting and just calming the skin.
So it's like closing the pores.
Something. Fire on ice. Like exactly the name.
Because you put the fire and then you have to cool it down.
Cool it down even, like it's very beneficial mask to the skin. Like just thinking about hydration, thinking about antioxidant, anti-inflammatory, stimulating collagen, and calming.
This is the step.
Yes, so relaxing.
This this is a style which you can do a little of a massage on the face if you want. Okay. If you want, you can. Or else you can just let it be on the face, depending on the. This need not to be timed, this particular style, but we left it ideally on for 10 minutes for the face to cool down, and this also helps hydrate the face. And so just leave it on the face. You can feel it on the hand, like you would feel beautiful. Because I feel it over my over my gloves. Relax.
That the second product.
This is good enough on the eye. I'll do the eye first because I don't want to put anything which is to a sensitive area first, right? So if I use serums, you might feel a lot of tingling.
And that one make like effective darkening because of the hyaluronic acid and glycolic.
You need not to go very close to the eye. If you just go on the periorbital. If you go very close, you will find a lot of itching. Can you open this? This are which one? Yeah, just keep press it on the nose. Just because it got little free. So we need 4 drops, not much. This much is good enough. Just apply. This has got 15% ascorbic acid, okay, which is a very stabilized form of vitamin C which can be used in the daytime as well. This has got vitamin A, E, olive leaf tea extract, mushroom extract. So it gives you that
Mushroom extract, you know, the benefits is so it's even whitening agent. And even the extracts, it has anti-acne, anti-inflammatory effect. That's why it is even for the acne.
then we apply a Pro Heal Hydra Cool Serum. This has got hyaluronic acid, catholic acid, and this is vitamin B5. A little of a menthol touch, so it gives you that cooling effect also. This is a hydrate category product, so you can actually mix it up with any serum of this clinical, even other products. It's not gonna react with as such anything. But this is just hyaluronic acid which is going to give you the hydration. Then we apply a preparative moisture, which is this is too much. So this particular moisturizer has got extreme enzymes. This is one of the unique technology of this particular company, is Clinical, which is a registered trademark.
To repair the DNA photos.
So,
Even protect it from the photo damage.
so what exactly is the extreme enzyme? Are the plants which are extremophilic plants? As I said, everything that we use is has got it's plant source, botanically derived, right?
Mm-hmm.
So these plants are extremophilic plants which survive in harsh weather conditions. Okay, without sun, water, or anything, they still survive. Survive, you're going to say you will find them dead, like that they don't have, they are not live, they are like dead. But the moment you put them in water, they revive. Okay. So we are using the enzymes of those particular products in our couple of products, not everything. Now this particular product, because they are so self-sustaining, they will also protect your face from environmental aggressors. I can you see, I just took out very little, I've given you some. Okay. Which is extreme protect SPF 30. This is just not a sunblock, it's a 3-in-1 product which also does a hydration, moisturization of your face. It will not give you, will also treat you against fine lines and wrinkles and other things. It has got extremozymes also. Though we have another category of sunblock which is just a physical sunblock. It will not do anything else except protecting you from sun, which is moisturizing. But this one is does a bit of everything for you. So if you have those men coming to you who don't want to apply too much of products and they just want to apply one product, this sunblock is the product for them. So now I hope you understand, Jane.
We're going to replace the
Extreme protect.
yeah, that one that we're going to replace the UV.
You be smart.
Make up for me, sweet.
Wow. No, I really feel good. I mean, the skin's very soft. It's very nice.
Just you should look yourself.
I feel very smooth. My skin.
She doesn't want to get glycolic acid 60%. Papaya itself.
Foaming inside.
Yeah. So it's good for sensitive skin, especially because it does not give you that heat on the face and it does not peel off other enzymes, just heat your dead cells. So it's like that.
I really feel good. It's really good. Very smooth. It's very smooth, really. Wow. I love it.
You're really
You should
good.
try it. Yes, you should try the fire and ice because it really feels good. It really feels good. Oh, that's
So,
yes. I used the fire and ice facial and I feel so fresh. I feel so relaxed and it burns my skin. It looks brighter. It looks fresh and rejuvenated. Thank you. Thank you for watching the entire video. Please do subscribe and click the bell button for more